We're continuing on with Chapter 9, starting with the blood supply to the head and neck and major arteries of the face and oral cavity. So listed here are the major arteries of the face and oral cavity. It's important for you to be able to locate the larger blood vessels of the head and neck because these vessels may become compromised as a result of disease or during a dental procedure, such as an injection of a local anesthetic. Blood vessels may spread infection in the head and neck area, so we have to be careful and watch for that while we're working with our patients. So when we look at these different arteries, you need to know that when you are taking a pulse in your neck, you're using your carotid artery for that. When you're taking a pulse on an infant, like when doing CPR, you're using the brachial pulse for that. All arteries in the body have a pulse, just some are stronger than others. When we look at the veins and of the face and the oral cavity as listed here, the union of the temporal and maxillary veins forms the retromolar vein. The external jugular vein empties into the subclavian vein, and the facial vein begins near the nose. The deep facial vein courses from the pterygoid plexus to the facial vein, and the lingual veins begin on the dorsum or the top sides and undersurface of the tongue. With your cranial nerves, there are 12 pairs of cranial nerves, all connected to the brain. They serve as both sensory and motor functions. Some are only sensory, some are only motor, and some are both sensory and motor. So we're going to go down to the lymph nodes of the head and the neck. So as a dental professional, you may not be the one examining those lymph nodes, but the doctor will, as a provider, examine and palpate the lymph nodes of the head and neck very carefully during an extraoral examination or the examination on the outside of the mouth. They do this because enlarged lymph nodes might indicate infection or cancer, so they have to do a thorough extraoral examination on their patients to be sure that there are no indications of infection or cancer. The lymph nodes in the oral cavity drain oral structures. They drain things like teeth. If there's an abscess, they're going to drain through the lymph nodes. They also drain the eyes, ears, and nasal cavity and deeper areas of the throat. So lymphadenopathy is the term that we use for enlarged or palpable lymph nodes. Why does lymph node enlargement occur? Well, that's because infection or cancer results in an increased number and size of the lymphocytes in that area. So the lymphocytes grow as we have an infection, or they increase in the number, not grow, but the number increases in the lymphocytes that we have. And so the lymph nodes actually grow because there's more lymphocyte tissue in them or fluid in them. Lymph nodes are small and they're round or oval structures located in your lymph vessels. The major sites of lymph nodes are in your neck, which is called your cervical area, under your arms, which is your axillary area, and in your lower abdomen in your inguinal area. The lymph nodes of the head are classified as superficial, which means it's near the surface, or they can be deep, which are harder to palpate because they are so far located inside toward the middle of your body. So depending on their location, the nodes of the head drain tissues on the right or the left side, depending on where they're located. So you could have drainage of underarm deodorant into the lymph nodes, and that could cause swollen axillary lymph nodes or swollen lymph nodes in the underarm area. There are 5 groups of superficial lymph nodes in the head: the occipital, retroauricular, anterior auricular, superficial parotid, and facial nodes. Head and neck carcinomas often cause lymphadenopathy, so that swollen lymph nodes can be from head or neck carcinoma or cancers. So palpation of swollen lymph nodes can be the first indication of a carcinoma or a cancer in the neck. You can look at figure 19A, 919A in your book and see these swollen lymph nodes. For deep cervical lymph nodes, they're located along the length of the internal jugular vein on each side of the neck, deep to the sternocleidomastoid muscle. So a dental professional must palpate deep around that muscle to feel the deep cervical lymph nodes. So they're going to be pushing a lot harder in that area to be able to feel if there's anything that is out of the ordinary. With the lymphadenopathy is when a patient has an infection or cancer in a particular region or area of the head or neck. The lymph nodes in that region will respond by increasing in size and it'll become very firm. So just like if you've ever had like a sore throat, strep, and you feel your glands in your neck and they feel swollen and hard, those lymph nodes are swollen in your neck. So that's why they're feeling that. So lymphadenopathy results from an increase in both the size of each lymphocyte and the overall cell count of the lymphoid tissue, like I was talking about earlier. With an increase in the size and number of lymphocytes, the body is better able to fight off the disease. So our body is increasing those lymphocytes to fight off all of that infection and try to heal ourselves. Our lymphocytes cells are the body's main defense. So if the dentist feels that it's appropriate, they will make a referral to a physician if the enlarged lymph nodes are found during an examination. So your paranasal sinuses are the air conditioning spaces within the skull that communicate with the nasal cavity. So the different functions that they have are to produce mucus, to make your bones lighter in your skull, and provide resonance that helps produce sound. Each sinus is named for the bone in which it is located. So you have a maxillary sinus, a frontal sinus, ethmoid sinus, and a sphenoid sinus. So oftentimes a patient that has an infected sinus might complain of a toothache. And that's because the roots of the maxillary teeth are so close in proximity to the sinus floor that it feels like that they have a toothache when in fact it's the sinuses that are infected, or vice versa. They may think that they have a sinus infection when in fact it's a toothache because the anatomy is so close in proximity. So they may have generalized pain and not exactly sure what it is caused from. So you may have to take an x-ray to see, is it in fact the tooth that's bothering them, or is it in fact the sinuses that are inflamed and swollen and laying on the apex of the roots, and that pressure is what's causing the toothache. And it wouldn't be you that makes that diagnosis or that call, it would be the doctor. So just know that that can happen, and it is common when there is a lot of sinus pressure to have tooth pain as well on the maxillary arch. Thank you.